Well, HFO, MRI, put your hand up if you have heard. Has anyone heard of HFO? Have you registered?
Yes.
Put your hand up so I can see how many. So the forums don't always speak so positively about us. If you haven't been, please do come again. As things are evolving. In 2007, I'll give you a little history. In 2007, HFO MRA was created as an arm's length agency of the strategy. So our mandate was to give licensure information. I think to that end, we've actually achieved that goal, but things have changed a lot over the years, and so too have our services. Unfortunately, we are not a change agent. We don't have a phone to CPSO, nor do we to the Faculty of Medicine. But I would agree with Margaret in the sense that making yourself competitive is what you need to do, and whether that ends up taking you down the path to licensure or taking you down a different path. This is sort of what we focused on. So as time has gone by, we have also evolved. So if you haven't been for a while, please do come back or get in touch with your advisor to get current information, as well as attend some of the free sessions. So some of the sessions, can everyone read that? That font is kind of small.
It's in your PowerPoint package also.
So currently we've offered a lot of sessions around understanding, I'm sorry, your name was Hannah. Hannah had mentioned integration, cultural integration or intercultural competency, and we all know that this is something that a lot of people are talking about, intercultural competency. So understanding the Canadian healthcare system, there are free 5-day workshops to understanding the Canadian healthcare culture and products. So that is for international medical doctors as well as other regulated health professions. So all free. Of course, we offer orientation to licensure, and it's really important that you keep up to date on the information. So whether that's pre-arrival, which is ideal, but if you're here to come and make sure that things haven't changed. Hannah did a great job explaining the pathway, but some of the steps have changed, and we don't know when changes are going to happen, which is why you really need to make sure that you're going down the right road. So that's the primary mandate. OSCE, everyone, do you know what OSCE is?
Yeah.
Yes. So, unfortunately, so we know they're objective, structured clinical examinations, very important part of the licensure process, not just for doctors, but for many other healthcare professions. This is something that's very grounded in culture, right? So what we do when we examine patients or when we're talking to patients is very cultural. So OSCE prep is important. We now offer OSCE prep for the nurses, internationally educated, because now RNs have to do an OSCE as well, and as well as doctors. So again, the medical culture and communication programs. And if you can't come out to a session, what we're trying to do is put things online in a pre-recorded module, so that if you're like myself, I have a 7-year-old, and I work full-time, and I'm taking an online course. And guess when I do my online course? 5 o'clock in the morning, because that's the time I have. So if you're like me, I know that you're probably doing a part-time job, a full-time job, raising a family, trying to write exams, trying to squeeze everything in, and it's tough. I feel for you. I'm inspired by you, actually. That's why I get up at 5 o'clock in the morning to do my online course, because I'm working with my clients, and I'm thinking, they're doing 2 exams, raising a family, working a part-time job. I can get up and do 1 online course. So a lot of these things you can get what's called asynchronous. So you can, whenever it's convenient for you, you can log in and you can watch that video. Okay, so that's really important. If you've never done an OSCE before, or if you've done an OSCE in another place, it's good to get oriented toward what is the expectation here. Not even so much in dealing with patients, but also in what do I expect there? I've never been to an OSCE. If you don't know the actual landscape of it, it can be quite intimidating. What are the bells and whistles? How many stations? What can I bring? What can't I bring? So those orientation videos are meant to get you oriented toward taking that kind of exam. I think one of the things that we do well, we can work on a lot of different areas for sure, and I want you to know that we are, and I'm here to listen and to bring back lots of notes to the team. But I think one thing that we do really well is we do interview preparation very well. We have the resources and the capacity to manage multiple mini interviews. Have you ever heard of those, MMIs? Yeah? And what are those? Have you been on one?
Yeah.
Can you tell us about them?
We applied for the physician assistant program,
Okay.
but I didn't.
Okay. You know,
Recently also I went for the midwifery course, and also I failed.
you know,
They are mainly behavioral. They are mainly behavioral interviews, and you have multiple places to go, and they ask you questions which you should answer in a small way, and they ask you small questions, like small, I mean say less in number.
right. So they work a lot like the OSCE, right? You have several stations, multiple stations, but they can be very strange actually. Some of them can be puzzles, and some of them can look like they're clinical, but they're not clinical. And you move in and out of these 10-minute stations. So that's something we do really well. So if you've applied to the PA program, if you've applied to RT, MLT, Michener, almost all of Michener interviews are now MMI. We do those. So if you want to come in and experience a mock track, we just ran one yesterday, and we're running another one tomorrow for about 30 people. So we have the capacity to do that. If you have an interview, get in touch with us. Times have changed. We've changed along with them. So please, my time's up. Well, that's without all this. My time is up. So an important thing, so if you get an interview, please get in touch with us. Just, you know, I would encourage you to get back in touch with us. The MMI, the document review. Okay, and then
It's for the physician and the nurses, or also pharmacists?
everyone. All regulated health professions, and you know, as I said, we are doing our best to respond to your concerns. Obviously, we cannot increase the residency spots, but we do want to make you competitive. We do want to listen to you, and we know that interview preparation, it's not ideal, it's not a perfect world, it doesn't solve everything, but it helps you be competitive and get into some of the programs that we want you to get into and succeed. If you didn't get in, resilience, I think after IMG or International Medical Doctor should be a resilience and hard work. So I'm sorry, my time is up, but please talk to me afterwards and I have some other information.